good.
Okay, I'm
So proud
recording.
of you. Look at you in technology. Okay. All right.
Seriously. Okay.
Boss man.
All right. So I am at this point going to mute you.
Okay. If anyone has
And
any questions you want me to.
all right, you're muted, so I can't hear you guys saying anything, cussing me out or whatever. You can say whatever you want, and I'm not going to hear it. But Andrea, first of all, thank you for letting me present for you today. I appreciate that, and I think it's great that you're starting this new program and expanding your business offerings to dentists. Just to let you know, I don't know if Andrea shared with you, but I worked in the dental field for about 6 years. I worked in every area of the dental field except actually being a dentist. I worked at the front desk because that's where I started, and from there I worked in the billing and insurance department, and then one day I worked for a dental clinic that had three dentists. It was a family practice. It was the dad who'd been in practice for 30 years and two sons. One had been in practice with him for about 8 years, and then another son came into the practice while I was still working there. So um, the dad, he was an interesting man. He was a little bit grumpy and crotchety, and had a hard time getting along with his assistants. And so he kind of run them off every couple of years or a couple of months, depending on how much they could put up with him. So one day his assistant left, and he was in the middle of. She actually left in the middle of a root canal, and he needed help. So he grabbed me, pulled me off the front desk, and there I was. That's how I started working as a chairside assistant. So I kind of learned everything on the job, and everything that I've learned in the medical field and the medical consulting field, I've also learned on the job. I've been in the medical field for 33 years right now. And again, I'm giving you the whole shtick because I'm not exactly sure what Andrea has shared with you, but I'm the owner of Gold Star Medical Business Services. We've had the company now since 2006, and we primarily do medical billing for physicians, chiropractic clinics all over the country. We actually had a dental clinic at one time. It was a nonprofit clinic in Florida that we did billing for, and unfortunately they lost their funding, and so we discontinued our service with them, but we've done dental billing as well. And so part of the work that we also do is practice management consulting. I was a practice consultant for 10 years and worked with a lot of doctors, a lot of clinics, helping them build their practices. And one of their big needs is in staff training. So again, I really applaud you for taking this step. I think it's going to be very, very lucrative for you. I think that this is a good move for any business right now. If you can do healthcare consulting, I think you're moving into a great market. And so one of the biggest areas. What do I think you should charge for this? Okay, I'll talk to you about that here at the end of the session. Um, you know, yes, I will answer all the questions at the end, and yeah, just keep adding stuff. No problem. Very good. Um, so, one of the biggest areas of concern for any clinic, whether it's dental, medical, is the skill set of the front desk. A lot of times, you have to remember, and I'm sure you know this by now, in dealing with dentists primarily, I know that this is not what they went to school for. They didn't go to school to be businessmen. They went to school to be dentists. Essentially, they are technicians. They are healers. They want people to feel better. They have a heart for their patients. But when it comes to the business, you don't find a lot of them who are really, have an innate skill set at the business side of things. And that's where, as consultants, you can really, really shine and help them shine in their businesses. And of course, one of the biggest issues that they have is staff management and staff training. And so for you to be able to provide them with a staff training program is great. Now, the staff training that's involved in front desk is is kind of multifaceted, and we're going to touch just on the telephone skills portion of the front desk at this point. Um, you have there are basically three main components to a great front desk person. One is having great telephone skills, because having good telephone skills is going to help them control the practice. Having great appointment book skills and great people skills, and they also need to be good at collecting money at the same time. So they have to have these skill sets in order to do the job well. And a lot of times what happens is they a dentist or even any healthcare practitioner will sometimes think that they can just hire a young pretty face and that can answer phones and make appointments, and that's all there is to it. Where in essence it's really a lot more than that. I look at the front desk as the navigation system for an entire practice, whether that is a dental practice or whether that is a medical practice. Essentially, the front desk person controls whether that practice is going to operate efficiently and smoothly, or if it's just going to be chaos every single day. Okay, and one of there are several reasons why the first thing you want to identify in a good front desk receptionist are excellent telephone skills and excellent telephone etiquette. And why is that so important? Number one, you know that first impressions are lasting impressions. Actually, how they answer the phone is going to give a patient an immediate impression of that practice, and is going to, they may decide right then and there whether this is someplace they want to go to or someplace they don't want to go to. And let's face it, I've worked in the dental field, and I know that we would love to all have patients that come in every 6 months and get their teeth cleaned, and you never have to do any dental work. But most of the time, people are calling when it's an emergency. They're calling when they're hurting, when they have a toothache or they have a cracked tooth, and they need to be seen. They need to be seen right now. And for many people, they have very serious and relevant dental phobias about going to dentists. I was one of those people. I remember when I called my mother the day that I got the job working as a dental receptionist. My mother actually laughed at me. She laughed. She said, "Lisa, you're not going to last three days there." She said, "The second you hear a drill, you're going to pass out." That's what she said. And she was right. I was deathly afraid of dentists up until that point, until I learned more. But those were because of some of the impressions that I had of dental offices, and it was very, very scary for me. And I really believe that if I had gone to a dentist as a young child, or as a first time dental patient, where I had a nurturing and kind front desk person who kind of helped me calm me down and make me feel better, and then top it off with great dental care on the back end of it, that I would have had a whole different experience as a child. So remember that the first impressions are lasting impressions. The other thing that's so important about good telephone skills is the ability to screen out calls. To have the skills to screen and take messages, and let the practice continue to run while the phones are ringing and while patients are being checked in and out, is paramount to keeping everyone on task in the back, meaning everyone in the back, the dental assistants, the dentists themselves, the hygienists, keeping them on task and focused. And then the front desk person is going to be the front line for practice building and relationship building. And that's going to be through their handling of patient requests and patient concerns. And then, of course, it is also the front line of new patient acquisition. Patients call around and they want to find out what the price of this is and what the price of that is. And we have to remember that really when they're calling, what are they doing? They're calling for an appointment. When it all boils down to it, you have to get rid of all that excess, and you need to get down to the golden nugget of what the reason for their call is and identify that and get them through that process so you can convert that person into a new patient. So the first thing that I discuss always with, a dental office or a medical office as far as their front desk is making sure they have the equipment necessary to, to function. And I know, a lot of small practices when they're first starting practice, especially if it's not a big group or not a well-established group, they start out with cell phones, and keep them in their pockets. And so, I'm thinking that if you're going to be helping offices start up their practices, or if you're assessing their office equipment, make sure they have a good phone system. This isn't something that they should be skimping on, really. They need to make sure that they should have enough phones available, or their phone system set up in a way, whether it's remote, hands-free remote answering systems attached to their headsets where they can answer the phones basically from any place in the clinic. And what I say is, you look at the clinic, you look at the clinic's operations, and let's say you were out there doing an observation of that clinic and an office visit. You would want to make sure that they had the ability to answer the phone from anywhere in the clinic by the second ring. And the second ring, psychologically, there's been a lot of studies done on this as far as what is the best ring to answer a phone, and it has always come out to be the second ring. And the reason for that is the first ring supposedly gives the impression that you are not busy enough or you're too eager. And the second ring gives you enough time to get to the phone. But then if you get into the third ring or the fourth ring, there can be an underlying impression that you are either too busy for them, or you're not efficient enough. Okay, make sure that the staff people who are responsible for answering the phones have the ability to operate hands-free, so they can be talking and getting on their computers at the same time. They should have speakerphone features if at all possible. If necessary, nowadays, you can either do intercoms. There are a lot of really nice phone systems where you can intercom each other through headsets or through inter-room intercom features. Making sure, too, that there are adequate lines with enough rollover to be able to accept all of the phone calls to where you're not getting busy signals. If you have service through some kind of a cable or landline service, you can actually have the phone company do a 1-month usage study of your phones to see if you have adequate phone lines. And what they'll do is they'll calculate how many times patients or callers, not patients, are getting busy signals, and so on and so forth. Make sure that there is a great voicemail feature with multiple message options and multiple voicemail boxes, okay, for each of the people who would be handling different types of patient questions or issues. So, if you have the equipment, the next thing to remember is to train a staff person on how to use it, and also train the doctors how to use it. I remember as a practice consultant, a lot of times I would do my calls with my doctors during their lunch hour, and their staff people would be out to lunch and they'd be alone in the practice, and I can't tell you how many times I get cut off, or something would happen and they didn't know how to get on speakerphone, and they just didn't know how to use the phone. And everybody that is responsible for answering the phone in the clinic should know and get adequate training on how to use that equipment. And that's not just how to answer the phones, but that would be how to check voicemail. If somebody's on vacation, how to get to somebody else's voicemail box. so they can gather up messages for that person and so on and so forth. Um, a great front desk person should have a very pleasant voice. When I am training and hiring for or helping doctors hire front desk people, I tell the doctors to do a telephone interview because it's the only way you're going to know how well that person is going to do on the telephone is if you talk to them on the telephone and actually do a basic interview over the phone. Listen to the tone of their voice, listen to their language and grammar skills, listen to their level of confidence, okay? And, just make sure that you have that person that is going to really be the spark of the practice as your frontline person. And I also tell doctors that when they hire a front desk person that one of the key elements to a great front desk person is to be friendly. And I call it being almost aggressively friendly to where they have a very, very welcoming demeanor. And whether that is on the phone or whether that's in person, they need to make the patients feel welcome and make them feel like they are special and important. So, make sure that number one, just some of the basic skills at the front desk as far as answering the phones is answer the phone on the second ring. Okay. Always answer the phone with a smile. It's amazing how you can actually hear somebody smiling over the phone. If I was to do this, and I'm going to cover my webcam right now, and I'm just going to answer the phone like, what a normal person would be, answer a phone something like this. Doctor's office, this is Lisa, can I help you? Or, doctor's office, this is Lisa, can I help you? Can you hear the difference between the first one and the second one? The first one, I'm just answering the phone, I'm distracted, not really paying attention to what's going on that telephone call. I'm actually not in what I call present time consciousness. What I tell a staff person at that front desk is the second the phone rings, everything else needs to stop. Okay? And at least for a few seconds, even if it's long enough to answer that phone and get that person on hold for a second until you finish up whatever else you're doing, okay, that they have that they make that patient feel like, or that person on the phone feel like they're the most important person in the world. So answer the phone with a smile, get to the point very quickly, okay, and we're going to go through all of these elements in detail, a little bit more detail here. Screen your calls heavily. So you do not want to be in a situation where, excuse me, where the front desk person is constantly interrupting the doctor or other people within the office to take phone calls when it's not necessary. Okay, you can't. The front desk person has to be fairly strong-willed, and they have to have a strong enough personality in order to be able to tell somebody, no, we can't talk to you right now. We'll talk to you later, especially if it's not a patient. And make sure that when you get to talking to somebody on the phone, get their name as soon as possible so you can actually have a very personal conversation with them. So just a few rules for both incoming and outgoing calls. And I, every time I've taught this, this is where the audience runs a little bit cold, but I don't care because I think that this is super, super important. Number one, in this day and age, everybody's got cell phones on them, and it is probably one of the most counterproductive pieces of equipment in any business, whether it's a dental clinic or a medical clinic or any other business, is having staff people with their cell phones, with their own personal cell phones. If it's a huge problem, the office can require, as part of their employee policy and procedure, if they have it written into their policy and procedure manual, They can require that the staff people place their phone calls in a break room or leave them in their lockers or their purses, but that they do not have their cell phones on them at any time during business hours. They can go check their messages on break, during lunch, or whatever. The last thing you want to see if you're walking into any kind of a business or a clinic is somebody with their head down texting on a cell phone. You just do not want to see that happen. So there should be a hard and fast rule of cell phones being off during clinic hours, and I always call the doctors out on this as well. I tell them no cell phones during clinic hours. It doesn't matter who you are. There's nothing that is going on in your business that is so important that you have to take a call or a text right then and there. And if there is, I guarantee you, whoever is calling will call the main clinic number and let you know that it's an emergency. Okay? So the next thing you need to be able to do, so we get that out of the way as far as the incoming calls. Now, the other rule for incoming call is making sure that you're very quickly identifying the type of caller that you're dealing with. There are three kinds of callers that are going to call into a clinic. A non-patient, which would be a sales call. It could be a family member of somebody in the office, including the doctor. It could be a colleague, another dentist calling in. It could be an insurance company. Those are non-patients. Then you have what we have, the largest group of people that will be calling into a clinic are your existing patients, and then you have your new patients. So the first thing that a great front desk person needs to do is identify who they are speaking to. Why? Because then they'll be able to quickly move through the phone call and know what direction they're going to take that call. The next thing they want to do is very quickly identify the name of the caller so they can have a personal conversation with that caller. And they need to try, if possible, to limit that incoming call to 2 minutes or less. So you have to be able to get a lot of information and be able to go over a lot of information in a short period of time. Why? Because if you're stuck on a call for 5 minutes, 10 minutes, and then you have other calls coming in, you're putting people on hold, then you have people getting upset because they can't get through. It's not a good situation. If at all possible, you want calls being answered by a live person. You don't want it going straight to voicemail. So in order for that to happen, you should have about a 2-minute call or less. And so that's very, very important. Now for outgoing phone calls, same thing. No personal phone calls outgoing during business hours except on break or if it's some type of an emergency. All outgoing calls during business hours should be limited to clinic or patient business. And even if it's clinic business, every clinic has kind of a peak time, all right? Now, I know in dental practices that's a little bit different because you have a much steadier business. You're busy all day long, but you know that a lot of patients like to come in after work or towards the end of the day or in the early morning, and then it may slow down a little bit in the middle part of the day. Especially if you have pediatric practice, everybody wants the after school appointments, and so during those times, this isn't the time where if the front desk person is also handling billing, which in a small dental practice that may happen, you don't want that front desk person on the phone with an insurance company at 4:30 in the afternoon. They need to be able to do some good time management in order to be free to answer phone calls, to take appointments, and there should be very, very little, if any, outgoing calls during those peak times, those really busy times. And any personal phone calls should take place before or after each shift. So I have 10 cardinal rules for phone etiquette and for good phone skills, okay? The first cardinal rule that you should employ when you are answering the telephone in a clinic is that when the phone rings, you should immediately in your mind be thinking that this could be a new patient, okay? And that the new patient that's calling in is somebody famous. I mean, you never know. It could be the mayor of the town. It could very well be somebody very, very important. And we know human nature is we treat people who are important with greater respect and greater deference than people who we think are not important. So if in your mind or in the staff's mind they think that this could be somebody very, very important, then they're going to answer the phone and handle that patient just a little bit differently. Okay? And it's also going to be that anticipation of having that VIP coming into the practice is going to translate over the sound waves of the telephone. That person is going to hear that and be immediately engaged with that front desk person at a level that maybe they wouldn't be if you're just answering the phone as an afterthought. The next cardinal rule is, and this may sound a little strange, but I'll explain it. Cardinal rule 1 is when you're answering the phone, wow, this could be a new patient. Now, once you've answered the phone, if the caller hasn't really identified themselves, you know they're a patient, they say something like, I need to make an appointment, okay? Then at that point, you always want to assume that the caller is an existing patient. And this is a big mistake that I hear clinics make a lot. So what will happen is they'll answer the phone, and then the patient says, I need to make an appointment. And then I hear the front desk receptionist say, have you ever been seen before? Or have you ever been in here before? And an existing patient who's been to see this doctor 40 times over the last 30 years will get insulted over that. They will think that you should know who they are. Okay? You can never ever go wrong though if you assume that this is an existing patient, and there's a lot of reasons for that. One is most of the patients are going to be existing patients. So the odds are with you. Okay. The next thing is if it's an existing patient and you're always assuming that's an existing patient, if it's a new patient, psychologically they're thinking, oh, well, they have a lot of patients. Okay. So your response should always be, when was the last time you saw the doctor, or when was the last time you saw Dr. Miller? Not, have you ever been seen before, or are you new here, or anything like that. When was the last time you saw Dr. Miller? And that essentially lays the groundwork for the rest of the call, because then the patient is going to say, oh, it's been about 6 months ago, and then at that point, the front desk person can pull them up on the computer and verify when that last appointment is. Or if they have never been seen before, then they can go to the scheduling protocol of a new patient. And then if they say, well, I need to speak, let's say the patient says, I need to speak to the doctor. The first response is what? When was the last time you saw Dr. Miller? And they'll say, I'm not a patient. And then you know how to handle that call, because that call then gets screened for a call back later. And so when was the last time you saw the doctor is a great, great opening line after you have answered the call. Now, to answer the phone though, and to get that first contact, you want to keep it very simple and you want to get to the point. And I remember the first time I utilized this technique with clinics and I told them to answer the phone like this, they all were like, what? Really? And I tell you what, it works so wonderfully. So instead of answering the phone, Dr. Miller's office, this is Lisa, how may I help you? Or Dr. Miller's office, this is Lisa, may I help you? I can help you. I hear people say that. I can help you. Why not just say, Dr. Miller's office, this is Lisa, may I help you schedule an appointment? And then if it's a patient, what are they going to do? They're going to be like, yeah, okay, sure. And then you can go right into your scheduling. And what that does is it cuts down on the extraneous questions like how much are your fees and how much do you charge and do you take my insurance and all that. A lot of times it just totally cuts that out of the conversation, where that may have been the first thing that the patient was going to say. Okay? So when you say that to them, when you ask them, may I help you schedule an appointment, you're actually getting to the heart of why every patient, essentially calls the office, is to get in and see the doctor. It doesn't really matter. Everything else they say is just words, okay? The bottom line is, and when I'm teaching front desk skills to any new front desk person at a clinic, whether it's doctor, dentist, it doesn't matter. The bottom line is we're here to schedule appointments, and that's what we need to do at the front desk. We need to get them in to see the doctor, okay? And if they don't need an appointment, if you say, Dr. Miller's office, this is Lisa, may I help you schedule an appointment? And they say, oh, no, I don't need an appointment, I'm calling for something else. Oh, okay. When was the last time you saw the doctor? Oh, well, I'm not a patient. Okay. Now you can go ahead and you can screen that call out. So those first two statements, may I help you schedule an appointment? And then when was the last time you saw the doctor? Of course, and obviously, if the patient identifies themselves and you know who they are, you don't have to ask them that question of when was the last time you saw the doctor. But if you don't, then you would ask that question and then move on to the rest of the scheduling protocol. And so let's talk about how we deal with the different types, those three different types of patients. The first ones I want to deal with are the non-patients. These are going to be your family members, friends, business acquaintances, legal professionals, and sales calls, okay? And just depending on what the nature of that call is, you are essentially going to follow cardinal rule number 3, which is that unless the doctor or the staff member specifically let you know, meaning the front desk person know of an expected call, all unscheduled calls are messaged and given to the appropriate person at the end of the morning or afternoon shift, okay? So that means that, you know, if I was working front desk, if my doctor didn't come to me that morning and say, hey, I'm expecting a call from so-and-so, I'm expecting a call from, you know, great professional websites. They're going to be calling me sometime today to talk to me about my Google Plus. I need for you to put them through. If they call, go ahead and put them through. The doctor or the office manager, whoever that is, needs to relay that information to the front desk. If I'm a front desk person and I don't have any specific instructions, I'm immediately going to take a message and let them know that the person, whether it is the whether it's an insurance person, the office manager, a hygienist, the doctor, will get back to them shortly. Okay, I will not ever, ever, ever interrupt anybody in the clinic to take a call that is not pre-scheduled. Okay, and you know, even if the doctor is in the office but they're not seeing patients, you know, you hear about this a lot of times. The doctor is in the back, and what do we have issues with now as doctors is documentation, and so they may be spending, you know, an hour in the morning and an hour in the evening after they see patients, and maybe even time over their lunch hour to where they're working on their chart notes and their documentation, or they're contacting labs for, you know, to find out how that crown is coming along and so on and so forth. Well, you know, if they're in the back and they're not seeing patients, that doesn't mean that you put the call through. Okay, you still take a message and then let the doctor, and don't give it to them during patient hours, because they're going to want to leave the patient or step away and take that phone call, and then they may get stuck for 15 or 20 minutes, and then what happens is the doctor starts running behind, and we don't want that to happen. So guard your staff's time by making sure that you are screening out those calls and taking messages. If the person is a non-patient, or even if the person is a patient and just has a question for the doctor, the response is the doctor is with the patient, even if they're not with the patient. If the doctor is in the office, the doctor is with the patient, or the doctor is with patients. I can help you, or I'll be happy to take a message. If you'd like, I can direct you to the doctor's voicemail. Okay? Anything like that. You do not put that call through to the doctor or to anybody unless You have already gotten specific instructions on that. Sales calls will come in. Always attempt to take a message, and especially if it's a local person. A lot of times we don't want to be nice to salespeople, but they have a job to do, and as long as they're not too obnoxious, you want to be nice to them. And the thing is, if they're a local sales person, they're selling office equipment or whatever, and they're from that doctor's town, you don't want to blow them off and be rude to them, because these can be potential new patients for you. Okay? If it's a telemarketing call, tell the person that, and they're asking for the decision maker, in the clinic, get permission from the doctor to be the decision maker and tell them you're not interested in their product and you're requesting to be removed from the call list. Okay? Don't just ever say, I'm not interested, don't call, and hang up. Okay? You have to tell them, we're not interested in your product. We wish to be removed from your call list. Please remove us from your call list. Thank you very much. And make sure that they tell you that they are going to go ahead and do that. If you don't, then they have the right to call you back as many times as you want, and then you're continually getting those sales calls. A lot of times salespeople are not going to want to leave messages. They'll say, oh, I'll just call back. Okay, that's not going to work. You tell them, be very firm. You tell them, if the caller says, I'll just call back, let them know, hey, you're welcome to call back, but I do have to let you know that the doctor has instructed me that he will not speak with anybody unless he or she knows in advance what the call's in reference to. So if you'd like to leave a message, we'll call you back. All right. And then a lot of times it's just, click and you never hear from them again, or they show up at your front door. All right. So that's the dealing of the non-patients. Take messages. Don't interrupt the flow of the practice to take unnecessary phone calls. Okay. Only interrupt if it's so instructive. And sales calls always need to know what the call is in reference to. Existing patients are going to call for 3 reasons. One is to schedule an appointment. The other is going to be to check on their bill or make a payment, or know how much to make for a payment. Or they're going to call to quote unquote speak to the doctor. I mean, and you have patients like that. They, before they come in, they want to know if they should come in. They have a little twinge in their tooth. Should I come in or shouldn't I come in? And I really think I need to speak to the doctor first, because maybe the doctor can just give me some medicine and, make me feel better. So there's always these reasons why people would want to speak with the doctor. In dental, we don't have, you may have a hygienist that can act as a go-between. In medical, what usually happens is that calls get forwarded to the nurse, and then the nurse will call the patient back and talk to the patient. But in this case, in dental, we may not have that. We may not have that shield between the patient and the doctor. So that front desk person has to be the shield. And so on the scheduling of appointments, if you have a patient that says, I would like to schedule an appointment, or you ask the patient when they call, you ask, may I help you schedule an appointment? And if the patient says, yeah, I do, I need to schedule an appointment, then the next question is what? When was the last time you saw the doctor? Oh, it was 6 months ago, 3 months ago, a year ago, whenever. The person at the front desk looks that up on the computer and verifies, and then at that point, they will know where to schedule that patient. In another presentation I have a presentation on proper scheduling and setting up your appointment book so that you are making the flow of the practice go well. So essentially scheduling certain types of procedures at certain times during the day, because in dental we have to set up the rooms based on the equipment that's needed for the different procedures. So if you, for example, you would want to schedule all your fillings, back to back to back to back to back, and then you would want to schedule your crown preps at different times and your bridge preps at different times, and try to schedule those one after the other so that the doctors can get into a rhythm. and it will keep them better on schedule. And so with that in mind, it's very, very important that that front desk person know the structure of the schedule and never give the patient an opening to mess that up. And so we use what's called the two-choice rule for scheduling. And the two-choice rule is that number one, cardinal rule number 4, you never ask a patient, when would you like to come in? That's death to a practice, okay? Because as soon as you do that, you've probably added 5 minutes to your phone call. Because now all of a sudden you're dickering around with the patient about available times, all right? Or what would be good for you. Don't say that. Take control of that call. Take control of the appointment immediately. Look at your appointment book. Have in mind, if you're a front desk person, you should always have in mind where those open appointments are and guide the patient directly to those appointments. You get them the next available appointment and you give them two choices, a morning choice and an afternoon choice. So what you would do is, if the patient says, yes, I need to schedule an appointment, what would you prefer, morning or afternoon? If the patient says, I prefer afternoon, then you would take them to those next two available afternoon appointments and say, I have Monday at 2 or I have Thursday at 4. Which would you prefer? And then usually what happens is they'll take one of those two choices. 90% of the time, they're going to take one of those two choices and you're done. Okay? You've got the appointment scheduled and you can keep that call to under 2 minutes. And so you need to make sure that that you really encourage those front desk people to take control of that telephone call. Always check for the last appointment date and always ask if the patient has a new problem. Sometimes patients don't share these things and they don't always know when their last appointment was. I'll be honest with you, I don't remember when my last dental appointment was. I think it was a year ago, but I may be actually going on a year and a half. I don't know. So what I say doesn't mean I'm lying. It's just that, I don't, oh, stop. Don't say that. I have good teeth, mostly. Anyway, so, the thing is, patients don't know. They do not know all the time. And so you want to check. Thanks, Annalise. I appreciate that. I will look mine up and I'll let you know in the next couple of hours when my last one was. You guys are nuts. Anyway, I'll just Facebook her. And so always check for the last appointment date and always ask if the patient has a new problem. Sometimes you're assuming that they're coming in maybe just for their routine checkup, but always ask, do you have any issues or do you have any problems at your appointment that we need to address? And if they say, well, yeah, I was hit by a baseball and I cracked 4 teeth, well, you're going to have a little bit of a different appointment than just coming in for their routine cleaning, okay? So do make sure you know about that. Now, that would handle the appointments. Now let's talk about account inquiries, because patients do call in wanting to know about their bills and wanting to know about their insurance paid. Don't get caught with your pants down on these, okay? And what I mean by that is a lot of times what will happen is, in your effort to be helpful, the patient will call in, you'll ask them if they'd like to schedule an appointment. They say no. When was the last time you saw the doctor? Now it's an established patient, and you ask them, well, how may I help you? And they say, well, I need to check on my bill. I need to see if my insurance is paid. I haven't heard anything from them. And so at that point, what do you naturally do? You pull them up on the computer and you see this kind of cluster of a mess, and you try to go through it with them on the phone at that point in time. You really don't know what's going on. They don't know what's going on. And now the patient is getting more and more upset. So all account inquiries should never be handled on the initial call. You should always take a message, get the pertinent info, and tell the patient that either if you are the insurance department, if the front desk person is also the insurance department, or so-and-so in the insurance department will research the account and get back to them within 48 hours or 2 business days. Ask them if that's okay, all right, and then get a best time to call and give a status or update to that patient within the time frame that you've promised. So if the patient says, I need to know about what's going on with my bill, you can pull them up on the computer and say, oh yeah, okay, I have your account up here. I can see what you're talking about. Let me ask this of you. I would like to research this a little bit. I'd like to send this over to the insurance department. I'll talk to Jessica about this, and I will have Jessica do some more research and get back to you within 2 business days. Is that okay? And like I said, 90% of the patients are going to be, yeah, that's fine. Or they may say, well, I'm going out of town. And you figure it out. You figure out when would be a best time to call that patient back. And you say, all right, I'm going to put in the call notes that Jessica will research this and she will call you back within 2 business days. And then at that point, you have to make sure that that front desk person gets that message in a timely manner to the insurance department, and that research begins immediately. Now, then it becomes the responsibility of the insurance department or the billing department to call that patient back within 48 hours, whether they have an answer or not. Okay? So even if they're still working on it, they should call the patient back just to let them know, hey, we're still on it. We've got a call into your insurance company. We're trying to find out what's going on. We'll keep you posted. Okay? And sometimes you can actually email them to let them know, and so on and so forth. So you give them that status update within the time frame that's been promised. If the patient is calling to request to speak to the doctor, or a person is calling to request to speak to the doctor or to somebody else, it could be even a hygienist, or it could be the billing department, these would be the main reasons. Would be a health inquiry. It could be problems with the bill, complaint against the staff, or they want to sell them something or invite them somewhere. Always find out the reason for the call and assist them directly. The doctor should only be returning between 1 to 5% of these types of calls. They should be handled by you, the front desk person, or by a mid-level staff person, an office manager, billing department, so on and so forth. Okay? If the patient does not want to leave a message, if it's highly personal, or maybe it is a complaint, direct them to use email via your website for patient inquiries and requests. Okay? Let me know how I'm doing on time. I don't, we never really discussed how much time I have on this call. So, how are we doing? I'm going to take you off mute for a second.
Need this call to end.
How are we doing on time?
Hold on, we're checking.
I think I'm fine.
Hold on, we're looking at calendars. It looks like we're fine. Yeah, we're fine for about another, say, half hour.
Okay, perfect.
Cool.
Back on mute.
Okay. Goodbye.
Okay, cardinal rule number 7. And this is really important. This is kind of where the rubber meets the road when it comes to taking a person from being a good front desk person to a great front desk person. A great front desk person understands that there's no such thing as a shopper. I hear this all the time when I'm doing practice management consulting. It's like the front desk person or even the doctor will say something like, well, these patients call in and all they're doing is shopping around for the best price, and they want to know about their insurance, and we waste our time on the phone with them, and they don't, they never schedule an appointment. And my response to that is the reason they're not scheduling an appointment is that you're not giving them what they need, and what they need is an appointment. Okay? If they didn't need the care, they wouldn't be calling in the first place. I know patients call in, they want to know about prices and so on and so forth, but the bottom line is when it boils right down to it, 80 to 90% of the patients are going to schedule an appointment if they know you truly care about them and if you are truly concerned about their health and well-being. Because I can tell you right now, in today's healthcare environment, they don't get that. They don't get that feeling of of it being about them. They get the feeling of it being about their insurance and about their money, and that's why a lot of times they initiate phone calls, because they've never had that any other way. Okay? But I'll tell you right now is that when you start talking to the patients about them and about their issues and their problems, they are going to want to schedule an appointment with that doctor, not anywhere else. Okay? So cardinal rule number 8 is get the appointment. Stop dickering around with the patient about their insurance, about the different questions that they may be throwing out at you. Always bring them back to the appointment. And the way you do this is by following the scripting pattern of what I call the 4 things every patient wants to know. And basically, if you can control a phone call with this technique, you'll almost always get the patient to schedule an appointment, almost always. And the 4 things every patient wants to know is 1, what's wrong with me? 2, can you help me? 3, how long is this going to take? And 4, how much is this going to cost? Okay? So let me just give you a scenario. You have a patient that calls in and says, hey, may I help you schedule an appointment? And they say, yeah, but first I need to know, do you take my insurance? It's valid, okay? What's the patient doing? The patient is skipping to number 4. Okay, that's what they're doing. They're at number 4, and what you need to do is, in order to take control back over of that call, you've got to get them back to number 1. So you would say, oh, I'll be happy to answer that question, but let me ask you a few questions first. Can I have the name and the spelling of your name, please? All right, after you've established whether they're a new or established patient. Great. Jennifer, let me just ask you, what seems to be going on today? What's wrong? What happened? What is your issue? Oh, you just need a cleaning. Okay, great. Well, we can help you with that. Number 2. All right. And we have appointments for hygiene. We have 3 great hygienists here at the office that can take care of you. Any one of them. We've got appointment availability with all of them. Our hygiene appointments take about 45 minutes. And now you were asking about whether we took your insurance. So let me ask you, what is the insurance that you have? Oh, you have Delta Dental. Great. Yes, we are participating providers with Delta Dental. And so, yeah, it will be covered at 100% for 2 cleanings per year. So let's go ahead and get you scheduled for an appointment. Would you prefer morning or afternoon? And then you go through your scheduling protocol. Okay. So no matter where the issue is, okay, the patient says, I want to speak to the doctor. And you find out whether if you find out that this is a patient, you ask them, well, I understand you want to speak to the doctor. What seems to be the problem today? Well, I'm having this twinge in my tooth, and whatever the issue is. And then the front desk person's response would be, oh, wow, I can certainly give the doctor a message, but I will tell you that I don't want to waste your time. I know that if you're having a problem, the doctor is simply going to tell you to come on in and make an appointment. So while I have you on the phone, let's go ahead and make the appointment. So would you prefer morning or afternoon? Okay. And then you get right into that appointment scheduling. Then let them know. I'll go ahead and give the doctor a message and let him know to give you a call if he feels he needs to. Otherwise, we'll see you tomorrow at 10 o'clock. And a lot of times, once you get once they schedule the appointment, they'll say, oh, no, it's okay. I'll just talk to the doctor when I come in. And that's what happens. So, if you use this technique when you're discussing issues with patients, you can always, I worked front desk for years. I used this technique, and I had almost 100% appointment scheduling results from that. Because, the bottom line is, if you can address those 4 questions in that order, you're good as gold. You're going to be able to get those appointments with relatively little problem, and at the same time in a short period of time. You're not going to be wasting a lot of time. Okay. these are going to be some of the common opening statements by a patient. I'd like to make an appointment. Well, here's the thing. If a patient says, I'd like to make an appointment, you don't have to go through the 4 things. You certainly would want to ask them if they've ever been a patient before, when was the last time you saw the doctor, so you know where to schedule them. You would want to ask them what's wrong, number 1, because obviously you need to know where in the schedule to place them, okay? And then after that, though, you can go right into the appointment scheduling. You don't have to go through anything about cost. Don't volunteer cost if they're not asking, okay? If they want to know how much it's going to cost, all right, or how much do you charge for crowns, or how much do you charge for such and such, then at that point you would go back to number 1 and then work your way down 2, 3, and 4. Okay, and so these would be the most common opening statements by patients. And there are patients that are going to shop around, want to know how much a crown is. But the bottom line is, if you let them know how much you care, okay, then they're going to be more likely to want to see you, even if your crown fees are $50 more than the guy down the road. Okay, they're going to like you better. And remember, people who go, a lot of times people who go to dentists, patients become very loyal to their dentists, number 1. And number 2, those who have a lot of fear, like dental phobias, they will pay more to go to a dentist that appears to be caring and that appears to have a really good demeanor and a good bedside manner. And that starts with the front desk staff. Okay. So always remember that cardinal rule number 2. So if the patient says, I'd like to make an appointment, you go back to cardinal rule number 2, which is always assume they are what? An established patient. So you ask them, when was the last time you saw the doctor? Are you in pain? And if the patient has never been in, then you would say the doctor reserves times for new patient evaluations at 10 or 2. I have next Thursday at 10. I have the following Friday at 2. Which would you prefer? And you give them the 2 choices, get the appointment, and then make sure they know where the doctor is located, and then ask for the referral. This is just an example of a new patient phone slip that you can keep at the front desk when you're training new staff people. I like to use this. So essentially what we can do is we can pre-register the patient over the phone if necessary. And so you would go through the scheduling protocol, and then you would get the pertinent information. You don't use this to manage the phone call, but you use this to have all the information you need. So you get the patient's name, the date of the call, a daytime telephone where they can be reached, a home address, so you can go ahead and get them loaded into the computer. What is the primary reason for seeking care? Have you been in an accident? Because then if they have been in an accident, then their medical insurance may kick in instead of dental insurance. And at the very end, if you want to, you can ask, is there insurance we can check on for you? You don't have to do this, but you can if you want to. All right. But certainly if you don't go through the insurance protocol, then you would ask, who may we thank for referring you to our office? So that encourages referrals of new patients, because they think, well, you're assuming that they were referred, which means that you are a referral-based practice. Okay. And do you know where we're located? So they'll know how to find you. Okay. And so you can use something like this, or formulate one that is more appropriate to the dental practices. If the patient opens up with anything other than an affirmation of scheduling, then you go to cardinal rule number 2, which was when was the last time you saw the doctor, and then you move into your 4 questions. What's wrong? Oh, great. Well, we can help you. Here's what we need to do. We need to schedule an appointment, and these are when we have the appointment times available. And this is how long it's going to take. So if you have any other questions at that point, you don't have to do number 4, which is how much is it going to cost. Don't volunteer that if they don't ask. Now, if they ask, then at that point you could get into those questions. Okay. And the patient almost all the time will schedule an appointment if you follow these 4 rules. Okay. And the final rule of the 10 commandments of good telephone etiquette is number 10 is that the patient doesn't really need to know how much you know, but how much you care. And if they can hear that caring attitude over the phone, then more than likely they're going to go ahead and schedule an appointment with you. And money becomes secondary to the fact that they feel comfortable scheduling an appointment with you and they feel confident that you're going to take good care of them. Okay, so the last few slides is basically those cardinal rules outlined in what I call the 10 Commandments, which you are welcome to, learn and make sure that you understand how that all works within the confines of good telephone skills. And so I am now going to expand this and open up my chat. I will unmute you and I will put my glasses on so I can read this. Okay. Okay, Jeff, what do you think we should charge for this? Are you talking about the service or?
Yeah, I think Jeff had to step out for another meeting, but he was, yeah, I think talking about the overall service.
Well, what if we all? I think that's just we could probably have another call about that, but part of that is going to be what the service entails. Is the service going to entail phone consulting? Is it going to entail on-site staff training? Is it going to entail webinar training or a combination of all of that? There's a lot of different practice management programs that you can put together. For example, as Gold Star, I have like a full service consulting program that I charge a flat monthly rate for, and that includes a certain number of webinars each year, training webinars for the doctor and staff. It includes weekly 30-minute phone calls with the doctor. It includes unlimited email support, so on and so forth, and then that's one flat fee. I also have a billing consultant program where it's just for questions about billing. So it's mainly for me and the billing department to be able to confer about billing problems they may be having, or if they have an explanation of benefits they don't understand, or they don't know how to go about appealing a claim that's been denied, they'll call on me and I offer them tech support for just the billing department, and that's a lesser fee. Okay, and then I have a la carte fees. So I have basically a protocol where I have webinars such as this, and I just charge a flat hourly rate to present a webinar like I'm doing right now.
Do you have a suggested hourly rate for a service like this? I mean, we'll be doing some research on what our competitors are doing, and we'll get some input from our beta clients, but just out of curiosity, do you have?
I would a minimum of 50 an hour for consulting. That would be a minimum.
Okay.
I mean, our lowest hourly rate for any of our services is like 75. So.
For marketing services.
Yeah, I would say then you would start your consulting services at 100.
You what?
I would start if your minimum for marketing services is 75. I would say either 75 or even bring it up to 100 for the consulting services. But I would check because it's different for different fields as well. The dental field, the consulting services may be different. I know Andrea K. Johnston, she told me that she has consultants come into her dermatology practice once a year, and they spend 3 days there doing staff training and chart auditing and all that. They charge her $3,000 a day plus expenses, and it's a minimum of 3 days. So and they bring 2 people in to do training with the doctor and with the staff, and they do office observation and so on and so forth. So and that's dermatology. Now, you know, a family practice doctor, there's no way that a family practice doctor could afford that. So a lot of it has to do with what you feel the affordability factor would be for for your dentist, you know.
Okay.
Um, so,
Um,
you know, I certainly would not have published rates. Okay. I would
mhm.
I would definitely look at my rates as a depending on the size of the practice, because you know if you charge, let's say you decide to incorporate on-site visits, and I don't know if that's a product that you ever want to offer, but if you did, you know, you might start at $1,200 a day, for your consultant to go out and spend a couple of days and have like a minimum of 2 days. But if you're going to a clinic with, let's say they have 5 doctors and
Right.
6 hygienists, you're not going to want to charge $1,200 a day. You're going to charge a lot more than that. So if you publish $1,200 a day, they're going to snatch you up and you're going to be exhausted. So, you know, you kind of have to play that a little bit by ear. So,
That, that's fair.
yeah.
Okay. So you were talking about having a pleasant voice. What would you do with, and you were talking about how doctors should hire, but what if they already have a front desk receptionist and they don't have a pleasant voice? What do you do with that?
Well, it depends on, again, that's going to depend on whether they become a client of yours. If you do practice consulting, you will have to bring it to the doctor's attention. You know, you'll have to say, look, you know, we have, I, when I was doing, you know, and I still do some practice consulting, not as much now with the billing company, but when I was doing extensive practice consulting, one of the things that we did with all of our new clients was something called mystery shopper. And so somebody from our company would call up pretending to be a new patient and would throw questions out. You know, after we trained them, then we would call in and pretend to be a new patient. And we would ask, well, you know, do you take my insurance? And we would see whether how that staff person handles those calls, you know, and we would record those calls and then we would play the recording back for the doctors and usually they would fire them on the spot after hearing the way they were talking on the phone, you know. Um, but, but yeah, you would have to bring it to the doctor's attention and say, look, you know, I think you have a hindrance at the front desk in that your front desk person does not have a very pleasant voice. They're hard to understand. They sound a little bit uneducated. You know, there may be different reasons why they're not really cutting it on the phone. And then give them suggestions and say at the very least they should be answering the phone with a smile because it's gonna raise the tone of their voice and it's going to make that patient feel a little bit more welcome. You know, sometimes you just have the wrong person at that front desk and you actually have to make a change in order for it to affect change in the practice. So you may have to have a serious conversation with that doctor about that, you know.
Okay.
Um,
Um, a question from Annalise. You were talking whenever you did your example where you were smiling as a phone receptionist. It was it was also an alteration of your voice. But should men also have that alteration, or would it?
Make them like, you know how if men do that, it almost sounds mocking if they alter the pitch of their voice.
uh-huh.
I mean, what I don't know if like the way that you altered is just the way that like your smiling voice and men just have different, or are you saying like the higher pitched voices like
Well,
work better for that?
well, what happens is when you smile, the muscles in your larynx change position, and your voice will get higher, and so will a man's. It'll just naturally do that. I didn't make the voice higher by consciously making it higher. All I did was smile, and it made it higher.
Okay.
Okay. Yeah. And so, so I think it just needs to be pleasant. It just needs to sound like, you know, I mean, a man can have a gruff, grumpy sounding voice on the phone or a pleasant, soothing voice on the phone, you know, and if it's a nice, soothing baritone voice that's answering the phone, that might be okay, you know. So yeah, I just think it needs to be pleasant and needs to be, you need to feel welcome is the main thing. What?
Have this one client
Oh my God, his
who's
voice is like butter.
Okay, so it's one of those things like, would you like to schedule an appointment? We're like, yeah, I'd love to.
Yeah.
Anytime.
okay. So I want to. So with the screening technique, the only problem with that is that our company actually does call our clients quite a lot, especially at the beginning of any marketing we do. We have to do a lot of phone verifications, and during the project phase, you know, we'll have clients who will send us very hard emails to answer in writing, so we need to call them to get through those questions. And how would you suggest you know, coaching these front desk people to screen without impeding the project?
I think it goes down to, it comes down to your, for instance, if you have an email, they have a hard email that you really just need to handle over the phone. You should instruct the doctor to let the front desk person know that if your company calls, that if at all possible, they should allow you to take that call.
Okay, so it's essentially like giving them instructions to let a certain company through.
Yes, yes. So it's like I said, as long as the doctor says, hey, I sent an email to my website design company, if they call, I really need to take that call, okay? Unless I'm, in the middle of something that I can't break away from. So let me know if they call. And then that's fine, okay? And that would be the only situation under which that staff person would be interrupted. It would be the same thing if they were expecting a call from their tax accountant or their attorney about a certain legal matter or tax matter. Everybody's professional and everybody is busy, so it's just important that you coach your new clients to let the staff know that you may be calling and it's okay to interrupt the call, interrupt his or her practice. Okay.
Okay. And then I think the last question we had was, so if your patient is calling about, a financial or insurance-based question, and you say, let me do some research, blah, 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 what do you do if that patient is just angry or insisting that you help them right away or whatever?
I very, very rarely have had that happen to where they are that upset to where they absolutely want to be seen right, or they want to be talked to right away. So, typically what I will do is if they're extremely angry, I would say, you use the I understand technique. Hey, I understand that you're upset and I really want to help you, but it isn't going to do us any good for me to sit on the phone with you and try to figure out your ledger line item by line item while you're on the phone. That's not going to be productive for either one of us, and I don't want to waste your time, and I want to make sure that when I do have the answer, I have the correct answer for you. So give me a few, if you can't give me 48 hours, can you give me 24 hours? Most of the time the patient's going to say, sure, as long as you call me back. Now, it could be that you've got a new person that is inheriting a mess from an old staff person that never returned phone calls, and so they don't believe you. And that's where you have to, as a staff person, you have to say, I understand, I understand that this last staff person that was here didn't return your phone calls, but I assure you I will. And if I don't, you can come to the office and you can string me up by my thumbs. I promise. Just say something to them that will help them, be assured that you're going to call them back.
And that leads me into another question. What do you do if a patient wants to talk to the doctor right away and they're angry about something?
The doctor is with patients. Always, the doctor is with patients. Is there something I can help you with?
Okay.
Maybe you can, if you give me the message, maybe I can expedite having the doctor call you back. You know,
Okay.
and so tell me what's going on. And I'm going to do my best to help you, and I'm going to do my best to have the doctor get back to you as quickly as possible. But without a message, without knowing what's going on, Mrs. Smith, I'm just going to have to give the doctor the message. But if they know what this is in reference to, then we'll know better how to help you, and we'll be more prepared for our call with you.
Okay. Does anyone else have anything?
No.
I think that was it for now. But we're probably going to have like a meeting about some stuff. So if we come up with any other questions, I'll shoot them your way.
Sure, you bet.
Thanks,
Thank
Lisa.
you.
Oh, you're
Thanks.
very welcome. I'm so glad I got to talk to you all.
Yeah, it was great. Thank you.
Thank you.
I'll talk to you later, Mom.
Okay, bye. See ya.
Bye.